Ahead of World Alzheimer's Day, Alzheimer Disease International, ADI, released the World Alzheimer's Report 2019, Attitudes to Dementia. The report reveals the results of the largest Attitudes to Dementia survey ever undertaken, with almost 70,000 people across 155 countries and territories completing the survey. It spans 4 demographic groups: people living with dementia, caregivers, healthcare practitioners, and the general public. Some key findings of the report include: almost 80% of the general public are concerned about developing dementia at some point, and 1 in 4 people think that there is nothing we can do to prevent dementia. Unfortunately, 2 in 3 people still think that dementia is a normal part of aging, and 62% of healthcare practitioners still think it is a normal part of aging. Over 50% of healthcare practitioners agree that their own colleagues ignore people living with dementia, and 33% of people believe that if they had dementia, they would not be listened to by healthcare professionals. In addition, 40% of the general public think doctors and nurses ignore people with dementia. 1 in 5 people attribute dementia to bad luck, almost 10% to God's will, and 2% to witchcraft. 35% of caregivers across the world said they had hidden a family member's dementia diagnosis, and over 50% of caregivers report that their health has suffered as a result of their caregiving responsibilities. And lastly, every 3 seconds, someone in the world develops dementia. This report highlights the lack of knowledge, stigma, and discrimination that remain as very high barriers to providing meaningful diagnosis and care for patients who are at risk for and who are diagnosed with dementia. On a societal level, this negatively influences the allocation of necessary funding and support for Alzheimer's disease and related disorders. It is a call to action that we need to collaborate and do better, and we will. I want to ask our panelists to their reactions to that, and start with Mark.
This is sobering information. We all need to do better. And it starts with the care relationship that you have with whoever the clinician is. They're working with you over years. We need to focus on the strengths we have, that it's not just about suffering from a disease, it's about living with cognitive change, and there's a lot we can do.
I would say education, again, is the key to this. We see so much misinformation out there with Alzheimer's and related dementias. There's so much we can do, we should do, we must do in our communities. People, it's the elephant in the room. People are suffering, caregivers are suffering. We have to do better through education.
Agreed, same. Education is so important to make sure that we can engender hope in our patients and our caregivers and let them be as successful as they can be while dealing with this difficult disease.
I remember when I worked at the Alzheimer's Association almost 30 years ago now that many of these same attitudes were pervasive in the US. I think we've seen at least some segments of the population in our country change and be more willing to talk about this disease or set of diseases that is so stigmatizing. But clearly there's a global need for that effort to go beyond the subspecialists and specialists that focus on this area. I think every time we make a diagnosis and work with a patient and family with this disease, we have the opportunity to change the dialogue between ourselves and with their other providers and in the community and let their voices be heard. I think that's one of the most important things that we can do in making the diagnosis is to encourage people to speak up. Tell your representative, your senator about the issues that you're facing and trying to access services and so forth. And it's only through those collective voices that we'll be able to change the nature of this care and services that we give to our patients with these diseases.
I agree. This is not a them problem, this is our problem and us problem, and requires all of us to work together and collaborate to come up with the new solutions and do better. Be well.